Hey everyone, thanks so much for joining us here today. I'm joined today by Kentucky Morrow, the principal of the Dental Innovation Alliance. Kentucky, how are you today?
I'm well, thanks, Jared. How are you?
I'm doing well. I'm excited for us to chat. Would love to, if it's okay with you, just dive right in.
Yeah,
Do this. Would first love to hear just quickly, how how you came to be in the position you're in today. What led to this point, and why why you wanted to do this.
yeah. Happy to give some background. Originally, I'll say started out at undergrad, going back a little bit, wanted to be a professor of political science. Went to Emory and had a great experience there and started to go down that pathway, but realized I wanted to do something, I'll say more action oriented, but really that could have a more immediate impact on the world than writing research papers. From that, I decided to join a grad program at Johns Hopkins focused on healthcare. I grew up in Minnesota. Healthcare is a very large industry there, and transparently thought it was a non-cyclical industry that could be good to have a career in. What I ended up finding was really enjoyed the industry, ended up being passionate about it, and found it extremely interesting from a really market dynamic standpoint in terms of misalignment of incentives. A lot of innovation was happening as well. So was fortunate to go up to New York after that, joined in a mid-market investment bank where I was part of the healthcare team. And my coverage area really evolved over time, but spent a lot of time on medical devices and healthcare services as the real area of focus. And worked my way up there. Ultimately, was a VP, and then saw this really interesting opportunity with DIA, where it was this new VC fund focused on just the dental industry, and it touches multi-site healthcare beyond just dental. If you think about ophthalmology, vet, or so on, but what made it interesting was it wasn't just capital. The idea was to create really this investor network that included experienced operators of some of the largest customers for these new innovative technologies, as well as some of the other players in the dental industry that can add value. So, from being on the investment banking side, where you're helping advise companies on either raising capital or selling themselves, I consistently saw this market gap where founders would be left on their own. And oftentimes the capital that they took on could be a hindrance for them because all they were was capital. They didn't really know the industry, and thought Dia was really unique in terms of being able to truly add value beyond just capital. And then also providing real assistance to founders, both in the form of sales connections, but also a deep understanding of the industry that's different than the cursory approach most investment firms take. Decided to kind of join the fund really at its inception and have loved every minute since.
So I know our audience would love to hear what key factors are you considering when you're evaluating these early stage dental tech companies for investment.
Yeah, and maybe I'll give a bit of background about what our real focus is because I think that'll help um, people understand what we're looking for. We tend to invest in what I'll call the seed to Series A investment stage, and what that really means is it's companies with some early market traction that haven't scaled yet. So often we're seeing anywhere from $500,000 up to $5 million in revenue. And they're typically growing 100% plus year over year. And what that really allows us to do is be an accelerant to their growth. It's hard for us to get behind an idea because we're not the ones that are able to take an idea and make it reality. We're trying to find founders and support them that have made their idea a reality, have early traction, but be an accelerant to that growth, help them grow faster, not just with capital, but with that sales connectivity and knowledge as well. I'll say on the medical device side, will sometimes look a little bit earlier stage than the software side, just because you have a regulatory process that takes more time, it takes more capital to get up and scale. When we're considering investments, what we often look for is number one, the founding team. It's much better to back an A team with a B level idea than an A idea with a B level team. And then, second, beyond that, really trying to understand the white space in the market where they see the opportunity, how there's that understanding. And then, third, is really ambitious ideas, and maybe it's the flip side to the question, but I'll say 70% of my conversations that I have with founders, I say this is a really good idea, but it's not a venture idea. And what I mean by that is you have a great idea, you found a pain point in the market, but the market opportunity might be 50 million, $100 million in total. And that's an incredible outcome for anyone. But for us, we're really seeking those companies that have the potential, and most of them won't make it, but the potential to hit that $1 billion market opportunity. So I think all of those factors are where we really try to spend our time.
Now, I'm sure you see your fair deal of challenges, your fair share of challenges with these companies, right? So, what challenges do you often see of it doesn't have to just be related to your portfolio either, just in the space, do you see these companies face when it comes to scaling? And let's talk about, I know Adia has an approach to helping with scaling. What does that look like as well? But would first like to dive into some of these challenges.
Yeah, I think that's a great point on scaling. The dental market is a surprisingly hard market to crack and really scale in, at least compared to some of the other markets. But it's also good in other ways. So I'll touch maybe on the bad first and then talk about some of the good. The bad is that it remains relatively fragmented. You're making SMB sales, which means it's very hard to develop a sales force that's cost effective, going door to door and selling. Number one. Number two, it's a very price sensitive customer base. People are excited about innovation, but they're very cost conscious. They're trying to maintain their margin profile. And three, I think there's a bit of a challenge from the industry in terms of there's a lot of focus on developing new softwares, new techniques, devices, and so on. But there hasn't been a focus on integration and allowing for those platforms to communicate well with each other. It's been relatively siloed to date, which means that a lot of these startup founders, I'd say 50% of their job is solving the same problem that another startup founders faced in terms of figuring out integrations with different parties or figuring out how to communicate that. On the flip side, I'll maybe touch on the good, which is dental, while historically has had an underinvestment in technology, it's had the opportunity to learn from the mistakes that were made on what I'll call the medical field in terms of adopting these technologies. So what we're seeing is it's not just a step to catch up to medical, but there's really the potential to take a leap ahead. Similar to if you look at some of the cities in East Asia, for example, they have these new technologies that are very different than the East Coast simply because they scaled later. And we're seeing that same opportunity in dental where you can take the lessons, build better technologies, build them faster than what are these legacy systems within a hospital, for example. The other factor that we're seeing is dentists themselves and clinicians are extremely entrepreneurial. They're often business owners themselves. It's a field where they're much more inclined and business savvy than others, which helps make that sales process easier in terms of communicating ROI, understanding the business challenges. What Dia does that maybe is a little bit different and doesn't touch on either of those elements is this new force of DSOs that's entering the industry. We have a lot of connectivity to those networks, and they're an interesting middle ground where it is consolidated and it allows you to scale faster, make sales, and can support a sales force that's going direct to the customers that you might not be able to for a traditional SMB sales approach. It's not to say it's not without challenges, right? If you're trying to sell to a very large DSO, you're probably going to face some more pricing pressure correspondingly, just because of their size. They're going to want a discount. But overall, we see it as immensely positive to work with those DSOs to be able to scale your sales strategy. And in particular, we find that early stage startup companies that start with either large group practices or small DSOs tend to have the most success because they learn those hard lessons early, but they have a much more repeatable sales cycle and sales process.
Now, what technologies are you most excited about today that you view as transforming dental care? I guess what are the most promising technologies in this space moving into the future?
I think that's a great question. We try to break the world up into, we have a list of 52 different areas of dental innovation that we track and thematically look at. It's frankly hard to pick a few that we're more excited about than others, just because we see both a lot of low hanging fruit, but also a lot of real opportunity to generate meaningful improvement to the dental sector. I'd say areas that we see real potential that I think there's a lot of companies potentially addressing, or we're really excited about companies addressing, but there hasn't been that killer app, so to speak, that we're looking at and really excited about and would want to fund, would be revenue cycle management slash insure tech. Historically, dental's lagged behind medical on that approach, and I think if anyone tells you they love their RCM process, they're lying to you, or they don't actually understand their RCM process. Uh, Diagnostics, from a device standpoint, we're seeing a lot of early adopter clinicians begin to adopt those and very excited about their potential. And kind of what dovetails to that is dental medical integration, being able to share care, both within medical practices to dental practices, but also the other way around. We see diagnostics as really the first stage of that much deeper integration overall. And then the final one that I'll touch on is process automation, practice analytics, both from the financial standpoint, but there's just a lot of back office activity that's done in a dental practice that we think can be automated. And that dovetails well with AI machine learning solutions that are being built and scaled out. That's obviously something a lot of people are excited about now. But, one of the companies we're invested in is called Uptime Health. They do equipment maintenance and compliance tracking, automate that process as well. And they're starting to develop some AI machine learning tools as well. But really, the core of the platform was creating a more streamlined process and automating it in a lot of different ways than Excel sheets or pen and paper, even for what I'll say is a relatively mundane and overlooked task in the office. But we see many of those tasks that can provide immense savings both to practices to be more profitable, but correspondingly that can translate to greater patient care and outreach because there's more staff time available as well.
What's interesting about Uptime too is obviously they had the acquisition, which they've done a great job in getting that up to speed quickly. You and I both obviously we know Janesh, and a big fan of the work he's done over there. Before I met him, I never realized the importance of what they're doing, and then really started learning about it. And there's certain businesses, right? You come across Kentucky, it just makes sense.
Yeah.
We need this. And I think to your point with the revenue cycle management, I just had a conversation with someone on the health system side of things, but there's still obviously some similarities. And we were talking about just AI's impact on revenue cycle management. And again, it's just one thing that makes sense. Whenever there's that heavy data analysis that needs to be done and there's ample data, AI is obviously implementing it makes perfect sense. So I guess I wanted to ask you this: as dental technology evolves, what do you think will be the continuous role of AI and machine learning in both shaping clinical outcomes but also business operations? Let's go out the next decade even.
I think that's a really interesting question, and I'll break it into two different parts. I'll say on the clinical side, I think we're in the early innings of that because we have uh, diagnostic imaging. We made an investment in Pearl in terms of radiographed imaging. We also have an investment in a company called Relu that listeners probably know less of because they sell directly to OEMs that use their software, white label it for 3D imaging solutions and techniques as well. I think what people will begin to see is use of much better treatment planning for patients, both on the diagnostic side, which Pearl is starting to do, but also as you think about leveraging these imaging solutions. Even if you think about sensors, there's been a lot of innovation there, allowing for better techniques. But as you get into 3D topology, um, CBCT and intraoral scanners are really in the last 10, 15 years, they've achieved adoption. So we now have these images, but people are still relatively new to reading them, understanding their full potential in the practice. And once you're able to build full digital twins, replicas of the mouth, you can create much better solutions. And I think that enables robotic surgery for the dental market beyond some of the early solutions, which were great. They provided guided surgery, but I'm talking truly automated surgery, automated treatment planning that can drive additional throughput for the practice. On the, I'll call it back office side, I think there's a ton of low hanging fruit there. My concern, frankly, is that there's so much low hanging fruit. Some of the solutions in this initial wave being developed are simply leveraging LLMs or other kind of basic data process automations to address that, which is good, right? We need those solutions. But my concern is that when you think about a data startup or a data driven startup, you really have three different ways to differentiate yourself in the market. You can have better data and more data than someone else. You can have a better sales process, or you can have a unique set of data that's differentiated than others. And what I'm seeing right now from a lot of startups is they don't have a unique set of data. They don't have more data than anyone else. And if you play the sales game, you can do that, but it often becomes a race to the bottom or a race of who can raise the most capital, and no one ends up being better off. So what I would say is there's so much low hanging fruit. I would think about some of those larger trends within the dental industry, not just about, hey, how do I process this one thing? And I think Uptime Health is actually a great example of that, where they've connected it to the broader ecosystem of we take a process, automate that, but it touches all these other processes. So we're going to streamline your actual bookings of technicians to come out to the service. We're going to start providing predictive analytics as well. So taking that next step of how do we connect this data and these models that we're building to not just address one localized problem, but really address system-wide problems or much deeper problems within the office that can then solve, maybe bring it full circle, that challenge that I noted in the dental industry of these siloed solutions. So rather than creating another siloed solution, a open system that can allow for better automation.
I love it. Kentucky, it's been an absolute pleasure having you on the show here today and hearing your thoughts on the future of the dental industry. I hope we can have you come back on in the near future, and look forward to staying in touch with you. But thanks so much for your time here today.
Jared, it's been a pleasure. I really appreciate you having me on and looking forward to continuing the conversation.